Okay, good afternoon, everyone.
Good afternoon.
For those of you who may not know me, my name is Naomi Stapleton Brownbill. I am a registered nurse midwife at the JNF Hospital. I work in the neonatal department, commonly known as the nursery. I was invited here today to do a little presentation with you all on care of the newborn infant. Throughout this presentation, I intend for us to do discussions, and by the end of the presentation, we will understand some of the terms related to a newborn, caring for a newborn baby. We'll be able to explain some of the procedures involved in caring for a newborn baby, the definition of breastfeeding, list how breast milk is stored, and we'll have some demonstration on swaddling of the newborn baby and bathing of the newborn baby. I will begin with the terms, and one of our first terms is mature infant. Is anyone able to tell me what or who is considered a mature infant? Anybody? We have any mommies here before?
Mine is 19 and 5.
Give me a hint.
It will be like a full-term baby.
Yes.
What months is
Like
that
40,
from?
40, like
Yes.
40 weeks. That's a mature baby.
No. No, but I'll explain. But just give me your ideas so I would know
Okay.
how deep I have to go in terms of definition. Well, as you all said, a mature infant is a child born at a gestational age. I'll explain what is gestation. Gestational age is like pregnancy, has to do with the pregnancy and development. And it's 37 to 40 weeks gestation, completed weeks, okay? During pregnancy, you will hear the nurse or the doctor explain your pregnancy in terms of weeks. We don't normally use months, but we know that a full-term baby is a baby who is 9 months. For a woman who is 9 months pregnant, and if you calculate it, you will realize that it is actual 37 weeks. So any baby born at 37 weeks up to 40 weeks, a pregnancy though, however, lasts 40 weeks. And if you check it in months, it will be 10 months. But it's 40 weeks. So anything from 39 weeks, which is the 9 months, upward to 40 weeks is considered full term. If it goes over 40 weeks, we consider that baby what we call a post-term baby, a post-mature baby. It means that you went over your due date. Okay? Now, a premature infant, a premature baby. What is a premature? And what is the full term? Okay, so yes, so a premature is any baby born before 37 weeks. Now, we have early premature and we have late premature. Early premature is before 32 weeks, and late premature is after 32. Okay? Now, you just heard me use the term gestation, and as I was saying, it has to do in relation to pregnancy and development. So this is the period of development in the womb from conception until birth. Conception means from the minute you get pregnant up until the baby is born. So this term is used in relation to pregnancy. So what is a newborn baby? Anybody? A newborn baby? What is a newborn?
A baby that's born for the full 9 months. They just get a baby.
Okay. A newborn is a child or baby who recently, or what we said, the baby just born. Now this baby can be hours, days, up to a few weeks old. And a few weeks old means less than 4 to 6 weeks. Okay? Now, an infant, in the other hand, some persons use newborn and use infant interrelatedly, but they have different definitions. Okay? An infant is a very young child or baby. It's usually used for babies under 1 year old. So if you are less than 6 weeks, you are considered a newborn. If you are over 6 weeks, you are an infant. Okay? You also use infant in relation to educationally when you're dealing with children under the age of 7. That's where you have kindergarten and so forth. Those are infant. Okay? And preschoolers are still considered infants when you're talking about educational aspect. So I'm now going to touch on the assessment part for the newborn babies. Now you are at the hospital, you deliver your baby is born, and it's good to know what to expect while you're at the hospital, what the nurses or the doctors will do in relation to checking out your baby. Okay? So we do an assessment. Each newborn baby is carefully checked at birth for signs of problems or complications. So we do a full, complete physical assessment, and this includes every system in the body. So we check the baby from head to toe. Okay? Throughout your hospital stay, doctors, nurses, and other healthcare providers continually assess the health of the baby, observing for signs of problems or illnesses. So usually when you get a baby, if it's a normal vaginal delivery, you usually stay at least 2 to 3 days in the hospital. And during this period while you are in the hospital, the nurses usually and the doctor usually assess the baby to identify if there are any problems. It's usually an observation process in relation to the baby. There are things that the nurse may see immediately after a baby is born, and there are other things that might show up like a day or 2 or sometimes more after the baby is born. Now, if you have a cesarean section, you might be in the hospital longer than the 2 to 3 days. Okay? If you have a premature baby, you're usually in the hospital for way longer than the 2 to 3 days. It's usually until the baby is at least 3 pounds and doing well. So if we have a mommy who had a premature baby, we don't usually give them a time frame, and we don't usually tell them, oh, you will be here a month, you'll be here 2 months. It all depends on the condition of the baby, how the baby is adapting to the outer world, the weight gain of the baby, and all of that. So we usually just tell them, relax. You will know in advance before you leave, because we'll give you a heads up. Like for instance, if we have a premature baby and we realize we usually wear our premature babies Mondays, Wednesdays, and Fridays. So when we wear the baby, once the baby is doing well out of the incubator at the mommy bedside, and we keep continually wearing the baby, and we realize that the baby is nearing the 3 pounds weight, we tell you in advance. Baby is almost the 3 pounds weight. You will have to prepare your home. For a premature baby, we usually tell the district nurses that we have a premature baby, and this premature baby is expected to go home. We usually give them the weight, the day the baby born, how much weeks pregnant the mommy was. Okay? Usually why we do this is because a premature baby is more prone to illnesses, and we have to make sure that the home is suitable for a premature newborn. Okay? we don't normally do it for a mature baby unless the baby has some sort of illness or complications, or if someone alerts us that there may be a home situation that needs looking into and it could affect the baby's health. Now, one of the things we do while we are assessing the baby, one of the immediate things we do is called an APGAR score. And we usually write the APGAR score. It's right here. You see APGAR score in the baby's clinic card. We've had mothers who ask what it is, and we have had to explain what it was. Okay, so this is one of the first checks for the new baby, and it gives us an indication of the baby's health. It also gives us an indication of what interventions is needed to be done. So the APGAR score is assigned in the first few minutes after birth to help identify babies that have difficulty breathing or have a problem that needs further care, as I just said before. The baby is checked at 1 minute, 5 minutes, 1 minute and 5 minutes after birth. You check the heart, the respiratory rates, the muscle tone, reflexes, and the color. So the A is for appearance, P is for pulse as in the heart rate, G is for grimace, A is for activity, and the R is for respirations. Everybody get that? That's what the APGAR stands for. Appearance, pulse, grimace, activity, and respirations. And those are what we look for. Each area can have a score of 0, 1, or 2. 10 points is the maximum score. So a baby can score 0 for appearance, can score 1 or can score 2, can score 0 for pulse. If there's no heart rate, the baby will actually get a 0 for that, and so on and so on. A total score of 10 means that the baby is at the best possible condition. Nearly all babies score between 8 and 10, with 1 or 2 points taken off for the blue hands and feet because of immature circulation. Now, if we do an APGAR score and the baby does not score 8 or 10, well, the first minute is not as critical as the 5 minutes. The baby can score very low, which means less than 8 in the first minute, because sometimes it takes a while for the baby to adapt to outside of the womb. So that is why you have to recheck in 5 minutes. Now, if you have a baby who scores less than 8, 7, 6, 5 within the first 5 minutes after birth, then that is an indication to you that you need to do extra interventions, whether you're going to give oxygen, help the baby breathe. That is what prompts you to do more activities. If the baby does not score above 8 within 5 minutes, then you go on to 10 minutes, 15 minutes, 20 minutes, 25 minutes, okay? If a baby has a difficult time during delivery, it can lower oxygen levels in the blood, which can cause you to get a lower APGAR score. APGAR score of 3 or less often mean a baby needs immediate attention and care. An APGAR score of 3 or less is practically almost a dead baby, and this is a baby that you might need to do chest compressions with, give oxygen, get a doctor come in and do start up an IV or put a tube down into the airways and bag the baby and so forth. This is a baby that requires a lot of interventions, and it is very critical that we get the baby scores up within the first 5 minutes, because after the first 5 minutes you could have activities, complications with brain activity. Okay. We also check the birth weight of the baby. Any questions about the APGAR scoring before I move on to the weight?
That's when they put the baby on the light on the table and scoring.
Yes, it actually starts from the minute the baby comes out. You already push the baby, or if it's a C-section, from the minute the doctor take the baby from the tummy, your first assessment is always with your eyes, so it's what you see first. Okay? Sometimes the baby come out crying, and as they say, you might just realize that the baby hands and feet might be blue. That is not anything alarming, but if you get a baby and the baby is what we call limp, the baby is not doing anything at all, no cry, no activity, the baby is blue all over, not just the hands and feet, you don't see any breathing activity to say the baby is breathing, then you know automatically this is a baby that you have to step in and start doing interventions for. So if a baby comes out when the baby is born, baby is delivered, and the baby is crying and so forth, we may not do anything much for the baby. You might just see us dry off the baby and leave the baby with you. But if the baby comes out and the baby is limp, immediately we will take the baby immediately and take the baby to what we call the resuscitator. That's the area with the bright light and the bed looking thing, and that is when we would start our interventions. We have to get the baby crying. Yes. Once you see us take the baby immediately from you and take the baby over there, then you know, especially if you didn't hear the baby cry, because we have to get the baby crying. That is an indication that the baby is breathing. Okay. Any other questions? Yeah.
For the chest compression, so we have to do the chest, the baby.
Okay.
Go the small.
We don't do it like big people.
I feel like one.
Yeah. I must put this in my bag. Okay, we don't normally do it like how, you know, with big people you do the chest compression like that. With a baby, you usually use your 2 thumb fingers. You put your fingers underneath the back and you press down on the chest area just above there on the sternum, and that will help to pump blood out of the heart into the circulatory system and into the lungs, and it gets the baby breathing. Okay? Any other questions? You could also use 2 fingers like that to get the heart pumping, but this way is most effective. So you will quicker see us hold the baby like this and do this instead of just doing that. Okay? Any other questions? Yes?
How long would they stay under the light? Like if they have a complication?
If we realize that there is a complication, the baby do not stay underneath there like for 10 minutes. If we realize that there is a complication, we call the doctor, the pediatrician right away, and we move the baby from the delivery room, where we tell the mommy quickly, mommy, we need to go with the baby, we need to do some other stuff for the baby, and we'll come back and inform you. And we take the baby immediately to the nursery, where we might have to start oxygen, prepare for when doctor come, because doctor might want to put in a catheter to start IV fluids and so forth. But you as the nurse is usually the one who takes the baby and take the baby to the nursery in preparation for the doctor. So you start your interventions like your oxygen, continue with your chest compressions and so forth, continue monitoring the heart rate and the breathing. If you as the nurse realize that the baby is not breathing, you don't wait for the doctor to come. You are the one who usually start to bag the baby to get the baby breathing. Okay, so we don't usually wait that long. If we try, like, as I said, 5 minutes is very critical. And if we try in the 5 minutes and we realize nothing is happening, we call doctor right away and we take the baby to the nursery right away. Yeah. Any other questions?
So the doctor comes immediately.
Yes, immediately. And most of the times, we are happy to say that the nurses are very competent. So most of the time we recognize that there will be an issue even before the baby is born. So by the time the baby is born, most of the time the pediatrician is already on his way or is already there. Okay. So I'll be moving on to weighing of the baby. A baby's birth weight is an important indicator of health. The average birth weight for a term baby is about 5 to 7 pounds, or you might see 2.27 to 3.2 kilograms. In general, small babies, and we call small babies once they are less than 2 kilograms, and those that are very large babies, which is more than 4 kilograms, like more than 9 pounds, those are at higher risk for problems. So the smaller the baby, the bigger the possibility that there will be an issue. The smaller the baby, the bigger the possibility that you might have to call in the pediatrician. The bigger the baby, there's a high possibility too that you will have to call in the pediatrician just to stand by. Babies are weighed after birth and upon discharge in the nursery to assess growth, fluid and nutritional needs. Newborn babies may often lose up to 10% of their birth weight. Once the baby loses more than 10% of their birth weight, which are sometimes recognized when the baby is discharged, because once the baby is healthy, we don't weigh the baby every day. As I was saying before, the most babies that are weighed are the ill babies that are in nursery or the premature babies. We weigh them Monday, Wednesday, Friday. Full-term babies who are normal and healthy, they are weighed shortly after birth and upon discharge, which is usually 2 to 3 days. Sometimes when we are weighing these babies, we may realize that the baby actually loses more than 10% of the birth weight. What we usually do, we either keep them for maybe a day or 2 more, or sometimes we may contact the community nurses, the health center, and we will let them know that we have a baby who's lost more than 10% of the birth weight and they will need follow-up. So we give them what we call a discharge summary, and that discharge summary will have on the baby's birth weight and what the baby discharge weight is and what we intend for them to do, whether we would like them to check the weight again, repeat the weight again in 2 days. If they repeat the weight again and the weight is not improved, they usually contact the pediatrician, and the pediatrician will guide accordingly as to what he wants them to do. Babies will usually gain their weight back by 2 weeks of age. So the baby is normal for the baby to lose some weight after birth because what we call the fluid loss, that is normal, but by the time the baby is 2 weeks old, the baby should already reach back to the birth weight. During our assessment also with the weights, we also do some measurements, and these measurements are what we call the head circumference. Let me just use the baby as an example. So we do the head circumference around the head. We also do what we call the biped diameter, which is from one bone on this side. You know, you got some tiny bones on the side of your head. We measure the distance from one to the other. We measure the abdominal circumference, which is your waist. We measure the baby waist. We also measure the length of the baby, how long the baby is, and we do vital signs, which is the temperature, the heart rate, the respiratory rate, and we do something called the SpO2, which is the arterial, the saturation of the arterial blood with oxygen. So we measure that level.
Oh,
yes.
The shape, yeah, the shape, the heads too.
No.
Y'all don't shake bed.
No.
Y'all just leave it.
Yes, it usually shakes on its own. When a baby is being born, the bone of the skull is not fused like us in adults. They are what we call sutures here, and those sutures help the bones to overlap. Remember, the baby have to come through a 10-centimeter passage. So those bones, when they compress, when you press on them, the pressure from the pushing and so forth will cause the bones to overlap. And as these bones overlap, some babies, they automatically regain their normal shape, and some babies, it takes some time for it to regain its shape. Okay? But we don't necessarily like sculpt the head to shape the head or anything like that. So those were measurements and assessment. Presently at the hospital, one of the things we also do as part of our assessment is we check the baby's blood sugar to see if the blood sugar is low or if it's too high. Okay? I'll be moving on to feeding. What is the best food for babies?
Breast milk.
Thank you. So breast milk should remain the main food in a baby's diet during the transitional months. So currently at the hospital, we are in the process of becoming what baby friendly certified. So we highly advocate for breast milk. So we encourage a lot of breastfeeding, and we try as much as possible to offer support and assistance with breastfeeding. Formula should only be given if it is prescribed by a pediatrician. So no nurse or worker at the hospital should be encouraging a newborn mother, whether they are at the hospital or at their home, to buy formula. We should not be advocating formula. We should be encouraging breastfeeding. Also, we do not give baby solid foods. So no soup. We had an instance where a mommy gave her newborn baby soup. We don't give soup. Breast milk, breast milk, breast milk. At least for the first 6 months. So from newborn to 6 months, breast milk. So what is breastfeeding? Breastfeeding, darling. Okay, so breastfeeding is feeding of an infant or a young child with breast milk directly from the female human breast rather than from a baby bottle or other containers. So breast milk, even if you're giving it from a cup, it is not breastfeeding. That is considered cup feeding. Breast milk, as it indicates, is from the breast. If you're giving breast milk from a cup, yes, you are giving breast milk, but you are cup feeding. If you are giving it from a bottle, breast milk from a bottle, yes, you are giving breast milk, but you are bottle feeding. Okay? So, what are some of the benefits of breastfeeding? Anybody? The benefits of breastfeeding?
The baby gets all the nutrients it requires.
Okay. Feeding. That's some of the benefits.
Benefits of breastfeeding.
Mm-hmm.
Prevent constipation.
Mm-hmm.
Give the baby the nutrition that it needs.
Mm-hmm.
Help the mother uterus to contract,
Mm-hmm.
come back in place.
Mm-hmm.
Prevent enlargement.
Okay. Mm-hmm. Benefits of breastfeeding.
Helps prevent sickness.
Mm-hmm.
Also helps the mother to lose weight as well.
Okay. So some additional,
Bonding.
yes, some additional was the bonding. because the mom and the baby get to do skin to skin and they get to bond. And it also helps prevent some of the chronic diseases that we face, like the diabetes, and it is easily digested. So that is in relation to the baby. Huh? Yes, they tend to have a higher IQ, and some persons, they tend to say, oh, nothing goes so because I give my baby formula and my baby bright. Now when we say tend to have, not everybody, not because you breastfeed means that you're going to become a scholar. It just means that everybody is intelligent in their own way, but these babies tend to learn things very easily. As they grow up, they tend to learn things very easily. They pick up on things. They're very smart for their age. Okay? So some of the benefits for the mommy, as the nurse said before, it helps to lose weight. It reduces delivery bleeding, so because the womb can go back in its place. So it helps to prevent what we call anemia or low blood. It delays next pregnancy for some people, not everybody. It has some protect against breast cancer. It helps with emotional bonding, and the thing that I love most about it is that there's no need for preparation. So I ain't got to get up to go hot in the water or go in a flask full of water. Me ain't got to go wash out in the bottle. That is what I love most.
You can't get them off the breast.
So another thing you need to know when you're breastfeeding is how to properly attach the baby to the breast. Now, with attaching the baby to the breast, you first have to make sure that you position the baby correctly. Let me take the baby out the blanket. Cool. So you position the baby to the height of the breast. You have to ensure that the baby's mouth is aligned with the nipple, the mouth and the nose aligned with the nipple, the ear, the shoulder and the hip. If you cannot make an imaginary straight line, if your line is slanted, it means that you don't have the baby positioned properly. Okay? And you get the baby to open its mouth wide, and then you place the baby on the areola. The areola is the dark area of the breast, not the nipple. Okay? You get the baby to open as wide as possible, with the chin leading, the chin coming first, and you get the baby to open wide and you attach the baby. Now, I often tell my patients that if when the baby is sucking, you are feeling it in your tummy and not your nipple, that's a good indication that you're doing it correctly. If you're not hearing it, some mothers, they got the baby on the breast and they feel that the baby making that sound and it's cute, so they feel that they're doing it correctly. I tell them, once you're hearing those sounds, the baby is not on the breast, it is actually on the nipple. And one of the things that could happen if you have the baby just on the nipple, you could get sore nipples, your breast would not be properly emptied, and you would not be producing the amount of milk you should, because the milk is already there, it's not empty to replenish. And also that milk can stay inside there and cause what we call engorgement, which could lead to inflammation of the breast, which is the mastitis, and then you end up to have to go do surgery to drain it and all of that. So I usually tell my patients, if you're having a problem with breastfeeding, come to the nursery and ask for some assistance. We will assist you with properly attaching the baby to the breast. Now also, one of the things we look for before we send you home with the baby, you must be able to breastfeed effectively. Once you are a breastfeeding mother, because not every baby will be breastfed, because there are conditions where you cannot breastfeed. But once you are a breastfeeding mother, we have to be competent enough to say, yes, this mommy knows how to breastfeed and can breastfeed her baby effectively. Okay? We also teach you how to do expression, be it hand expression or using a pump. If you don't have a pump, we will teach you how to do it using your hands. If you have a pump, we usually tell you to bring your pump so that we can go through the usage of your pump with you, so that by the time you go home you adequately know how to use the pump. And just how you breastfeed the baby, we encourage you to also pump as well. You can pump, express the breast milk every 3 hours. Okay? And breast milk can be stored. I will send around a paper so that you could see how it can be stored. Pass it around. This is your own little note. So how to store the breast milk? Breast milk can be stored on room temperature. It can be stored in a refrigerator. It can be stored in a home freezer, a deep freeze, a walk-in freezer if you have a walk-in freezer. So if you are storing the breast milk on room temperature, because of our climate, although this says it could last 6 to 8 hours, you have to take into consideration the type of temperatures they have here, which is up to 77 degrees Fahrenheit, which in our environment, unless you have air conditioned unit, your room is usually much warmer than that. So we say 2 to 4 hours. So if you're not going to use it within that time, we encourage you to put it in the refrigerator, and it can last in the refrigerator up to 5 days. It can last in the refrigerator freezer if you have one of them one-door refrigerator. It could last there for 2 weeks, and that is because it's one door, so you're constantly opening the freezer and the refrigerator. But if it's a refrigerator with the freezer compartment separate, it can last there for 3 to 6 months, and it can last in a deep freeze for 6 to 12 months. And if you have one of those walk-in rooms, freezer rooms, it can last there for up to 2 years. So we encourage our mothers to breastfeed and express so that you can have enough milk, even stored for when you return to work. Yes, we encourage 6 months breastfeeding, but we know that you usually return to work before the baby is 6 months. So that is why we encourage you to also do expressing. Okay? Any questions about breastfeeding? Now, if you have milk, since nobody have no questions, okay, go ahead.
What types of complications will cause a mother, because they are to advise a mother not to breastfeed, other than HIV?
There's also another condition, it's a STD as well. It's called HTN1. And those mothers do not breastfeed also. Sometimes some mommies develop bleeding from the breasts. So we might tell them to pause on the breastfeeding until the milk clears up. Or sometimes mommies may have infection in the breast. So when they express or they try to breastfeed, you get pus. And you might encourage them to refrain from the breastfeeding. Also, depending on the type of medication that a mommy may be on, although we try as much as possible to prescribe medication that does not interfere with breastfeeding, sometimes mommy might have to get a medication that interferes with breastfeeding, so she might be advised not to breastfeed. But we try as much as possible to use drugs, medications that does not interfere with breastfeeding. So if you express your breast milk, you must be taught you already been taught how to store it. You must be taught how to prepare it after you store it. So we encourage mothers who express breast milk to store it in the amounts that the baby usually eats. Now, if you have a baby who usually eats 3 ounces a day, a feed. We encourage you, when you're storing the breast milk, to store it in 3 ounces, because you could eventually waste milk. Or if you want to say you're going to store an extra ounce just in case if the baby wants a little bit more, you could store 4 ounces. If you have it in the freezer, you either put the milk in warm water and let it thaw down, turn back to liquid, or you could leave it at room temperature and let it thaw down. If that milk is thawed, you have 24 hours to use it. If you store it in containers and you're feeding directly from the container, whatever is left in that container, you have to throw it away. So if you store it and you put it in a separate container and feed from the separate container, you have 24 hours to use it. But if you're feeding directly from that container, whatever is left, you have to throw it away. Okay? So feeding continues 6 to 12 months. This is when you start to introduce other foods like your rice cereals and your porridge, and then you move on to your fruits and your vegetables, your mashed pumpkin and potatoes and those stuff. Yes, and water and juices. But if you're using juices, it's unsweetened juices. We don't encourage you to feed children under 1 year sweets. So some of the things you need to know is also, when you're caring for a baby, is physical activity. Some mothers, because the baby is a newborn baby, tend to feel that the baby is not able to do anything. And we're seeing more and more now where baby is born and turning over, trying to lift up the head and all of those things, and they're just born, right? So babies build neck and shoulder strength through tummy time. Now tummy time is where you take the baby, you put the baby on the tummy, whether in the bed or on a play mat, not with the head facing down. The head you must always turn the head on this side, so just in case the baby fall on the face, it does not suffocate. And you give the baby some time like that to learn how to do different stuff, whether to lift its body, trying to turn its head. It's like a little playtime for the baby. Supervision is a must during these brief sessions, and it's just briefly, not all day. And you don't keep the baby there to fall asleep on its tummy and so forth. You, as I said, you could use a blanket or there's little play mats while you're doing that, and you don't put toys in the reach, and you give them some room to wiggle, squirm and stretch. There are instances where baby might be in cot at the hospital and the mommy have so much things in the cot that the baby can't even stretch its legs, cannot move its legs. So we sometimes tell you to remove most of the items from the cot, and that is to give the baby some time to move about. And for babies who are 6 to 12 months, you give them some opportunity to practice new skills, such as the rolling over, sitting up, walking. You try to discourage screen time as much as possible, like giving them long periods watching television, and giving them long periods with tablets and phones and so forth. And you see that a lot. This young baby, like 6-7 months, and the child already have a tablet just rest there, or the phone just rest there. You try as much as possible to limit the screen time, and you could use colorful toys appropriate for those ages to introduce colors and so forth to the baby and help to stimulate the brain. I'll be moving on to vaccinations. Everybody know what are vaccinations? Vaccinations are the same as the immunizations. Everybody familiar with them? Okay. I'll send around a schedule which gives you an idea of the type of vaccines that your baby will be given. This is up to 5 years. So these vaccines help your baby to build up defenses against serious illnesses and diseases. We have persons who say, who may complain and ask, why do we need to give the babies vaccines when a baby is born? It's like a blank slate. Baby don't have any exposures to these things, and the only how you get to build up resistance to these things is if you get some exposure, so your body could build what we call antibodies, which will help you to fight them. So the vaccines is just a small dosage where we give the baby some exposure so the baby body could develop resistance to it. All babies, all newborn babies, once you are more than 2 kilograms, because remember we said less than 2 kilograms is considered small and you are prone for more complications. So once you are more than 2 kilograms and you are born within the Federation of St. Kitts and Nevis, you are given, the baby is given a hepatitis B vaccine shortly after birth. So that is the first vaccine the baby gets, is the hepatitis B vaccine. And the routine times of immunizations are at 2 months, 4 months, 6 months, 12 to 18 months, and 4 to 6 years old. Those are the routine vaccine times. Usually when you get your clinic card from the hospital, you will see here, okay, this one have it in. Yeah, it's me. Yeah. So this red that you see here, it's usually written in red. That's the first vaccine that the baby gets when the baby born. Okay? It's the hepatitis B vaccine. So we put it here. When you go to the health center on your first visit, they usually takes the card and they usually take the information from the card. Any questions about the vaccines? The appointments that is usually given for vaccines at the health center, the appointments that you normally get from the health center is usually around the time when the baby is due a vaccine. Unless this is something that they need to monitor closely, you will get a time before. But normally, if the baby is for a vaccine in 2 months, they will give you an appointment for when the baby is either 2 months or about to make 2 months. And then you will get another one when the baby is 4 months, 6 months, and so forth. Any questions? How often does a baby poo? Anybody?
At least once a day, baby should stool. Some of them have like 4 times a day, 4 or 5 times a day. And if the baby is stool, then you should be concerned.
I'll explain all of that. So some baby have bowel movements after every meal. That's ideal. Every time you feed, baby stool. That's ideal. But it doesn't mean that if your baby doesn't stool after eating, it means that there's an issue. It could be different reasons why, and I'll tell you different reasons. Between 6 weeks and 3 months of age, the frequency of the stooling typically decrease. We have had instances where we have mommies in the hospital and the baby accustomed to stool after every meal, and by the time they go home, the schedule change, because remember I say usually 2 to 3 days, so the schedule change, and they might call back and say, well, nurse, when I was in the hospital after every meal the baby stool. And this is information that would have gotten upon discharge, because we usually do discharge teaching. So sometimes it's just a little reinforcement. We tell them yes, but you know, feel the tummy, make sure that the tummy is soft. You have to observe all of that. How have you been feeling? There are a few questions we might ask you before we guide you accordingly. So many babies stool only once a day, and some as infrequent as once a week. There are babies who stool once a week and there is nothing wrong. Once you are breastfeeding and breastfeeding only, usually it's nothing wrong. This is usually not a sign of a problem as long as the baby maintains a healthy weight gain. How often should a baby pee, pass urine? How often? So a newborn's baby bladder is very small and holds only 1 tablespoon of urine, which is 15 mils of urine. So they may empty it quite often. That's why they pass so much urine. Only 15 mils the bladder could hold. Some babies will pee up to 20 times in one day. If your baby is sleeping, you don't need to wake the baby just to change the baby pamper. And this is something we tell mothers all the time. You don't need to wake the baby just because the pamper needs changing from urine. A change before or after each feeding is appropriate. Every 2 to 3 hours is also appropriate. And we all know how to change the pampers, right? We all know. You know how to change a pamper? Okay. You know how to change a pamper? I'll just read through it quickly. The first step is to place the baby on a clean, soft surface, safe surface. And the second step, you open up the pamper and you clean your baby. And usually we encourage you to clean the baby from front to back. And then you put on the clean pamper. You put your barrier cream on between the groins and the bottom. It could be the diaper creams or the Vaseline or the pure petroleum jelly. You put it in the groins and on the buttocks. And on the private area, Lord, don't put none inside the vagina. Okay? Not inside. You're putting it on the outside because you're just trying to get some barrier prevention. Because remember, urine is waste, and you're not gonna change the pamper all the time as soon as the baby just pee. Because the baby is sleeping, the baby will sleep until the baby gets up. So you need some barrier protection there. When you finish, you pin back up the pamper, you throw away the dirty pamper, and you wash your hands. Don't throw away the pamper in the toilet. You throw it in a waste bin. Yes, we have people who go and throw the pamper in the toilet, you know. Yeah. So you don't throw it in the toilet, you throw it in the waste bin. Yes. Yeah. We have people who do that. So when you finish that, you wash your hand, you dress the baby, you wash your hands, and you're good to go again. Okay? So now we're going to talk a little bit on bathing the baby. I have another picture here so that you could see how to bath the baby. And no need to worry. You will be taught how to bath the baby. This is another thing you have to make sure you are able to do before you leave the hospital also. You will be taught how to bath the baby and how you hold the baby for a bath. And it is usually like this. You start with the eyes and you cover the ears so that no water, so that no water could go inside the ears. You clean the eyes from the inside out. You change the area of the rag and you clean the other eye. You rinse the rag, you wipe the face. Yes. And you wash the baby hair. As soon as you finish washing the baby hair, you dry the hair immediately. And why do we dry the hair immediately? Anybody could tell me? Yes, the baby is very easy to lose heat from the body. And if you don't dry the hair immediately, the baby could get cold. So you dry the hair immediately. After you finish drying the hair immediately, all this while, remember the baby done already strip. I didn't say that, but the baby done strip, right? And you put the baby in the water. Now, the water must be an acceptable temperature for the baby. So you use your elbow, not your wrist. your elbow to check the temperature of the water, and if it's too warm for your elbow, it is too warm for the baby. Okay, when you're putting the baby in the water, this is how you hold the baby. You hold the baby supporting the back and under the lower arm. The head is usually rest here on the arm from the neck. Okay, you bath the front of the baby and the private and everything, and then you turn the baby over and you bath again. You wash the back and the buttocks. As soon as you finish, you dry the baby immediately. After you finish drying the baby immediately, you remove the baby from the wet towel and you start applying the baby clothes. Okay, simple. It's bathing of the baby. Usually the nurse is the one who shows you the first demonstration as to how to bath the baby, and then we observe you as you do the procedure to see if you do it properly. Okay, now I'll move on to sleeping if there are no questions about the bathing. Any questions?
Well, okay, why is someone stay down here first than the head?
We don't encourage that. We encourage you to start from the eyes. You clean the eyes first, and the reason for that is because you go from least contaminated to most contaminated. Okay, you use the hair first and dry the hair first, because as I said before, the baby loses most of the heat from the head. So you want to make sure that the head is dried and warm before you do the bath. I've also seen persons bath whole head, everything at the same time. That is something we don't encourage you to practice, because as I said before, the baby could get cold, and when the baby starts to get cold, the baby actually begins to turn blue and could actually develop with heart, whether the heart rate drop or get very rapid, the breathing could stop or get very rapid, and the baby chest could start to sink in to show you that the baby is having problem with breathing. So that's the reason why we do it in that those steps.
About the navel.
Oh, in relation to the umbilical cord, the navel, the nurses are the one who cleans the navel. If you are home and the baby still have on the pin on the navel, we encourage you to go to the health center to get the navel clean on a daily basis until the cord is off, until it falls off. The cord have up to 10 days to fall off. It varies. Now some mothers might say, well, why I got to carry the baby health center just to clean the cord? The umbilical cord is very important. It is the closest way for germs to reach to the baby's heart. It leads directly to the baby's heart. So if you don't do it properly, there's a high possibility that it could get infected, which could cause infections with the heart. Okay, so that is the reason why we ask our patients to take the baby to the health center, because we know for a fact the nurse is properly trained and she will do it the way how it's supposed to be done. And that's one of the reasons why we don't encourage you to put the cord inside of the pamper, just to make sure that it doesn't get contaminated with stool and urine and so forth. Okay, hold it. Yes, so you go daily, you get the cord clean up until the baby until it falls off. Okay, I will now touch sleep, because that is very important also. So babies have different sleep requirements depending on the age. So for a newborn baby to 3 months, it's recommended that the baby sleep for a total 14 to 17 hours. Acceptable range, not less than 11 hours or more than 19 hours a day. Nighttime sleep is 8 to 9 hours, could vary. This is just an average. Some babies sleep more in the day, some babies sleep more in the night, but this is just an average. And naps is 7 to 9 hours or 3 to 5 naps. There are some babies, as I said, the naps are very short, because we have instances where naps might just be about 15-20 minutes, and in no time the baby is up. Now, in relation to sleeping, not because your baby are not sleeping for long periods, it doesn't necessarily mean that the baby is not getting enough. It could indicate it that the baby is not getting enough when you breastfeed, but it does not necessarily mean that the baby is not getting enough, because the baby could very well be getting enough. Okay, there is such a thing called cluster feeding, where a baby could be up for 16 hours straight and just breastfeed for that 16 hours. Okay, that is also considered normal. So when you get your baby, you will be able to observe your baby, you will learn your baby friends, and what will become norm to you might not be a norm for somebody else. Okay?
Question. The baby only sleeping when you're lying down next to the baby, is that not?
That's comfort. That's comfort. That's when good bonding has taken place. The baby know you to a T.
There was so much good bonding for me there.
Yes. Good. That's awesome bonding. Yes. What you can do in a case like that is use something with your smell and put it close to the baby. Or sometimes what I used to do is record my voice. Sometimes what I used to do is record my voice and put it to play in the room, so they think I'm in the room, I'm in there. Give some water. Because baby no longer smelling you. Oh my goodness. So 4 to 11 months, this is where the baby tend to sleep less. Recommended sleep is 12 to 15 hours. As I said before, these are just averages. An acceptable range, not less than 10 hours or more than 18 hours. The nighttime sleep is 8 to 10 hours. Naps 4 to 5 hours or 2 to 3 naps. So it's usually less naps. By this time, the baby should already learn the routine, and most times might sleep more during the night than during the day. It's not so for every baby. As I said before, these are just averages. Now, what is swaddling the baby? This is something a lot of patients get excited over when they see the nurse swaddle the baby. And it is very good if you have a baby who likes comfort, who likes to be fed like it's being held and in the arms, to swaddle. So, and that's how I'm picking you, but Angel, come. Come and use this one for swaddling. I'll read it and you will just demonstrate it for me.
Wow, swaddling.
So I'll read it out first, and then I would let her do the demonstration. Hold the baby. Take the baby out the basket. So the first step for swaddling, you find a flat surface. So this will be a flat surface. You spread your swaddle blanket out in the shape of a diamond, with one corner pointing on a flat surface like the middle of your bed, and you fold the top corner down about 6 inches. So take the baby out of the blanket. We don't advocate bottles here. Hold the baby. So you fold the blanket, diamond shape. This is 6 inches, but it all depends on the size of the baby and the size of the blanket, okay? So diamond shaped, you fold it in, you put it on a flat surface, okay? The next step, you place your baby face up on the blanket. So you hold the head, sit above the folded edge of the blanket. So the head above the folded edge of the blanket, and your body. The head sit above the folded edge and her body extended straight down towards the bottom corner. Yes. So you straighten your baby's left arm. Usually babies don't stay one spot like that. They're usually very active. So you straighten the baby's left arm. As I said, not because this is the left arm, it doesn't necessarily have to be the left arm. You use a discretion on which arm you want to use. So then you take the left side of the blanket and you wrap it over the baby's chest. You tuck the blanket underneath her right arm and her back. Yes, very good. At this point, the baby's left arm will be covered by the right arm. Well, the right arm is free, sorry. Step 4, you bring up the bottom of the blanket. So you fold the bottom corner of the blanket up over your baby's body and you tuck it onto the first fold. Okay, you straighten your baby's right arm and you pull the right side of the blanket over your baby's body and you tuck it under the left side. Very good. And you secure the blanket. You can loosely twist the bottom of the blanket and tuck it underneath your baby. And just like that, your baby is swaddled. And you did very good.
It's like a pillow song.
So that was swaddling the baby, and this is very good when you, especially when you have a baby who is fussy and like comfort. You swaddle the baby, that way the baby feels like it's being cuddled at all times, and it feels like it's in a baby it's in somebody's arm. And babies tend to sleep very well when they are swaddled, and it also helps to keep them warm. So some of the complications that you may recognize when you have a newborn baby, you might hear us talk about jaundice a lot at the hospital, and this is the yellowing of the skin and other tissues of the newborn infant. It could be the eyes also. Usually, once it's a mild case of jaundice, you would be recommended to perform sun baths. And the sun baths is you remove the baby's clothes, you leave on the pamper and the hat. You pull the hat down over the baby's eyes, so the baby will be like this and without the clothes. And you give the baby 15 minutes in the sun facing upwards, and then another 15 minutes facing downward with the head on the side. Remember, don't put the baby flat on the face. And you do that twice a day for 1 week, and that's sun bath. Now, in severe cases where the jaundice is very severe, you are what we considered more than mild. Doctor will take off a blood sample, and he might usually start what we call phototherapy for the baby, where the baby will be placed under a blue light, or in very severe cases you might have to do what we call an exchange transfusion, where the baby might need to get blood. But once you hear us tell you the baby has a mild jaundice and you need to do sun baths, that is how you do the sun baths. Remove the clothes, you leave on the pamper and the hat, you give the baby, bring down the hat over the baby eyes, you give the baby 15 minutes on the front, 15 minutes on the back. So a total of half an hour. And you do that for twice a day for 1 week. Another thing you might hear about, remember I said before that we have started checking each baby blood sugar. So you might hear the baby has neonatal hypoglycemia, where the blood sugar may be low and we may need to do some interventions. Now, we only intervene if the blood sugar is low, if the baby have symptoms of a low blood sugar. Now, you may wonder, what is the symptoms? It's not the same as an adult. The baby might be very difficult to awaken, or you might see some little jittery movements for the baby. Those are what we call symptomatic. The baby is symptomatic of hypoglycemia, which is low blood sugar. The baby is showing signs that my sugar is low. Now, if the baby have low blood sugar and the baby have those signs, we are to call the pediatrician, and the pediatrician will tell us what to give, whether he wants the baby to get formula. That is another indication as to why we might give some formula. The baby will not be fed formula all the time. He might just get that formula just to bring back up the blood sugar, or sometimes he may order something we call dextrose, which is like similar to sugar water, and the baby might get some dextrose to help to bring up the blood sugars. Okay, but we as the nurses, we do not take it upon ourselves to give formula. Remember I said it has to be prescribed. Anything other than breast milk has to be prescribed. If it is in a severe case where the blood sugar is very, very low, doctor might come and start an IV for the baby. Now, if the baby blood sugar is low, I forget to mention this, and the baby is showing symptoms that the blood sugar is low and mommy has colostrum or milk in her breast, the baby will be going to the breast. We might either get mommy to come and express some of the breast milk, or we might let the baby feed directly from the breast. Okay, the only how formula comes in is if maybe the baby feed from the breast and we back check the blood sugar and the blood sugar is still low, or if mommy doesn't have anything at all in the breast, she has no milk, no colostrum, nothing, and the baby needs something to help bring up that sugar. So the first thing you do is check the mommy's breast to make sure that the mommy has stuff in her breast. Okay, you might also recognize that the baby might have, this is when you're at home, baby might have a high temperature, which is more than 101 or at 101. One of the first things you could do for a baby who may have an elevated temperature, you start removing some of the baby's clothes so the baby could get cool, and you give the baby a cool bath. Please, not an ice bath. A cool bath, and you dress the baby lightly. Please do not give anything unless a pediatrician tell you to give it, because there are some persons who might give the Paramol and they give either too little Paramol or they give either too much Paramol. So please, if you need to give the baby some liquid, some Paramol liquid, you have to get it from a pediatrician. Find out from the pediatrician how much is enough to give. Okay, and how often you give it also. But your first intervention should be removal of the clothes and a cool bath. Okay, now you cannot mention,
And one intervention should be taking the temperature too, because sometimes it's just the baby skin feel warm.
Yeah.
And you feel like...
Because that's how you will get a true actual temperature. And you dress, always remember to dress the baby according to the temperature of the climate. If you are in a warm environment, I don't expect you to have on the baby hat, sleeper, onesie, socks, the whole works, and still wrap up in a blanket and the place is piping hot. And also I don't expect you to be in a room like this. The baby ain't got on a hat, ain't got on a socks, ain't in a blanket, nothing. Okay, you dress the baby according to the temperature of the room or the temperature of the climate. Okay. You cannot talk about caring for a baby and not mention what we call sudden infant death syndrome or SIDS. Anybody here could tell me what is it? What is SIDS or sudden infant death syndrome? Okay. So the sudden infant death syndrome, this is sudden and unexpected death of an apparently healthy infant, not explained by careful postmortem studies. Now some people mix this with shaking baby syndrome. Shaking baby syndrome is where you shake the baby, and as a result of you shaking the baby end up with complications from the shaking, like maybe blindness, bleeding in the brain, problems with brain development, injury, you know, a lot of things could happen when you shake the baby. So we don't encourage you to shake the baby, but it is not the same as a sudden infant death syndrome. With sudden infant death syndrome, even if you do a autopsy, there still might not be an indication to tell you what the baby died from. So this is something that happened unexpectedly, unexplainable. It typically occurs between birth and age 9 months, with the highest incidence at 3 to 5 months. It's also called crib death or cot death because the infant often is found dead in the crib. And one of the ways how we could try as much as possible to prevent sudden infant death is not smoking around your baby, not using, you know, some of these blankets have particles that comes off very easily. We encourage you not to use those. No powders. What else?
Using your perfume and so.
Yes, nothing with strong odors. If you have like air conditioning in the room, you have to make sure you clean the vent quite often. What else?
Changing the bed sheet to changing the sheet.
Yes, and trying to prevent the amount of dust in that area also. You just try to eliminate anything that could cause the baby to have problems with breathing. Okay? And I have reached the end of my presentation. Yes. Jaundice. There are many different reasons for jaundice. One of the reasons could be problems with breastfeeding. It could be the baby has not been getting enough milk, and as a result the baby is not stooling enough, because part of your stool, chemical in your stool, is bilirubin. That is one will help to give the stool the color. It's bilirubin, and it's a buildup of bilirubin in the blood is what causes the jaundice. So if the baby is not stooling and passing enough urine, then the baby would not be excreting enough bilirubin. So this bilirubin get caught up in the blood, which causes the changes in the skin color and the eyes. So that could be an indication. Another indication is breast milk in itself. There is such a thing as breast milk jaundice, which has to do with a chemical reaction in the breast milk to the bilirubin that may cause the baby to get an increase in bilirubin levels. So if it is bilirubin jaundice, breast milk jaundice, sorry, doctor usually will stop breastfeeding like for 2 days. So for that 2 days, the baby he will prescribe formula for that 2 days, and that's another indication why the baby might not breastfeed. And then after the 2 days, you usually notice a rapid decrease in the bilirubin levels, and the skin colors and so on improve, and then doctor will resume breastfeeding. It could be problems with development of the liver, because the liver is responsible for bilirubin production. So that could be a that could be a problem that causes bilirubin also. It could be mommy and baby blood type is different. What we call incompatibility. They're not compatible. Baby have a different blood group to what the mommy have, and then there's changes, chemical imbalances.
Has the same blood type?
Yes, most times. And if you don't have your blood type, you should have the father blood type.
So there can be a case where he doesn't have any family father or the mother?
You have to have either the father or the mother. That means the man got wrong child. So you will get either or. And that's how sometimes persons know that a child is not theirs, because they ain't got the mommy blood type, and the father come give blood and they ain't got the father blood type either.
Weird things can happen?
Very rare. Very rare. Very, very rare.
The child is the father own, but
Very rare. It's very rare. Anything is possible, but it's very rare. Usually, if it's not, the mother is usually the father blood type. Sometimes, if it's mommy is A and the father is B, the baby might have AB. Might have both. Yeah.
something to do with surgeon.
Yeah. Anything else? Any other questions? Huh?
Eczema.
Eczema. Eczema is almost like an allergic reaction. There are different types, and usually it's like a chemical reaction to the body. It's similar to allergic reaction. So you just have to be careful. The products you use, and try not to introduce formula and those things. Sometimes it happens as a chemical reaction to like sweating and so forth. So it's basically like an allergic reaction, as I said before.
What are you trying with Johnson's?
Johnson's, we have seen that a lot of babies who have had Johnson's baby product actually show reactions to it. So try use a different brand. Yeah. And no powders, please. And no lotions, please. Once the baby is getting enough breast milk, the skin will be clean and nice and healthy.
So you
The baby skin. We have had instances where mommy come with lotion and all of that is necessary. If the baby needs something to the skin, we will tell you, and we usually ask for coconut oil. If we ask it to bring something for the baby skin, it's usually coconut oil. But as I said, that is only if absolutely necessary. It's not necessary.
So not even Vaseline?
Necessary.
Nice.
Yeah. Even if the baby born post dates, because sometimes it post date you might see the skin peeling and it might look dry and so on. Once you start to feed up the baby, the skin will improve.
Yeah.
So it's necessary. Anything else?
What with the pad?
What about the pads?
The
Where you gonna be wearing pads? Because after you get a baby, you tend to have some bleeding, what we call look. You remember you haven't seen a period in 9 months. So usually you tend to have some bleeding. That bleeding could last up to 10 days, sometimes more than 10 days. So you will need to have pads.
And what's the amount? If you see really a lot to see extra clots and them kind of
Yes,
things,
if you see clots like the size of your face and so forth, those are alarming signs.
Yeah, make sure you don't do that.
And you change your pads as often as possible. If you go to the bathroom, you change your pad.
Alarming signs?
Yeah, if it's passing clots as big as your face and so on.
You should contact your doctor. And it will be some people period from regular after, some people.
Yes, some people. It could be up to 6 months. Yeah, I got him in my hand like a baby. Understand.
Nurse Brownbill, on behalf of Care Nursing Agency, we'd like to say thank you for taking time out to come and share with us and educating us on the care of the infant, the newborn.
Okay, thank you very much. Thank you.